Georgia Santos, and this is Rosie Guzman. Rosie is an RN for Fidelity House, and I'm very fortunate to be with her today to talk a little bit about her community work in and around Merrimack Valley in Massachusetts. For the purposes of this course, I'm interested in learning more about the path her nursing has taken, along with her respective schooling, education, community work, what's led her to the decision to become a nurse within our community, how she manages her patients within the framework of assessments and caring for them, public health requirements, licensing and credentials, and where she feels the community is going with respect to their personal health care and healthcare needs, as well as funding. So good morning, Rosie.
Good morning.
So before talking about all your successes, I was interested in knowing what actually led you into your nursing career.
So I used to work as an assistant for a company called Mentor that would facilitate people and children actually that have no homes, and that the parents might have had substance abuse, and I ended up adopting a set of twins. Their biological mother had a substance abuse, and they were withdrawing from heroin. So that led me into my nursing because of all the multiple complications that my twins have. And I saw the desperate need in the community for more nursing, people that cared.
Excellent. Congratulations to
Thank
you.
Thank you.
So I've done a little bit of research on Fidelity House as a whole, but I feel it might make a little bit more sense. And thank you for the tour. So we took a tour around the facility here. What a wonderful facility it is. But could you talk a little bit about the Fidelity House and the involvement in the community?
So Fidelity is a nonprofit organization that cares for people that have developmental disabilities as well as physical disabilities. A lot of the population we serve have such diagnoses as cerebral palsy, autism, again, severe developmental delay, quadriplegics. And our job is to ensure that they're living quality life, and they get to go out in the community and just live like any other individual that does not have the diagnosis that they have with their comorbidities.
Excellent services. So describe a little bit in terms of your organization's services. I know clearly you have a group home such as this, but there's so many different facets to what you do.
So we have, the company provides care, something called adult foster care. So family members get to take care of their loved ones that do have developmental delays. Maybe they're not appropriate for long-term care units. And Fidelity House offers financial rewards for the families just to assist them in the daily care. They have monthly visits with the nurses from Fidelity and social workers that assist them in any needs, such as setting appointments, visiting, ensuring that the home they're in is safe. They also have residential, so it's people that live on their own and get monthly or weekly supervisions from the nurses, and as well as other social workers and human rights committees that go and ensure that they are living, in a safe environment and they're out in the community. Because unfortunately, people with developmental delays don't get the care that they always deserve.
Absolutely.
Because of their diagnosis.
So in terms of your involvement, I know that you do this group home, but talk a little bit about a day-to-day for you and the different facilities you're involved with.
So at a Fidelity House, they have 20 homes in the Merrimack Valley area, like you said, and some of the homes are assigned as medical homes. Some of the people have more health complications than others, so I'm assigned to 4 of the medical homes. And in those homes, you see people that have respiratory issues, as well as chronic kidney disease. These are just multiple diagnoses. And their medications need to be reviewed basically on a daily basis, ensure that the medication is given correctly. We have a lot of people with COPD, a lot of exacerbation occurring. So my day-to-day is basically going to the homes, looking through the books, completing physical assessments, ensuring that they are going out in the community. Again, one of the big things for Fidelity is that we want our clients to live a regular life. We don't want their diagnosis to define who they are. So we don't want to limit them. So my job, again, is to ensure that the medical needs are being met, as well as emotional needs.
Excellent. Now you have a really important role in terms of trying to pull all these different services together.
Mm-hmm.
So clearly you've got a nice staff here.
Mm-hmm.
What are some of the other organizations you work with in the community that help you ensure that these folks are getting taken care of well?
So we work with Greater Lawrence. It's a community-based clinic, and they actually set up a lot of the resources for us. A lot of our clients, again, have special needs, special devices to get into these places. So they do set up, some of them set up transportation for us. They, instead of having physical therapy, for example, going out into the community, physical therapists will come here. For some clients that don't have the accessibility that others, they set up, what else do they set up? Like resources, like public resources, for example, going to the Topsail Fair. So so they set up activities for them. So it's really nice. It's a really nice resource to have. Not to mention the fact that Fidelity contributes to their community activities. So
It's a great partnership.
Yeah.
A great partnership,
Yes.
and I've actually seen out and about some of the workings of it in the community, which I think is tremendous. How do you actually get folks that are referred to here? So if you knew somebody that had recently been diagnosed, I know we were chatting a little bit earlier, with a disability, like a cancer that needed special care, maybe the person was autistic and they needed some extra help to get them through either this period of chemotherapy. How do those clients find you?
Okay, so basically the clients are referred from DDS, what we like to call the Department of Developmental Services. And usually you have from very young age to 21, you can live with your home, with your parents, but unfortunately once you turn 21, there's not really a lot of services out there because you're considered an adult. It doesn't matter that you have developmental disabilities, and unfortunately some family members are unable to care for their loved ones, so they get a referral from DDS. This is how we've gotten most of our referrals. Another way is clients that live in nursing homes that are not getting the treatment that they deserve because of their diagnosis of mental disability. They get referred from the Department of Developmental Services, and then there's a long list that they have to go through, and usually courts are involved, and that's how we get our referrals, basically from the Department of Developmental Services. And if there's any calls on abuse, people that have these diagnoses.
It must be so frustrating for you to have to work through all of those challenges in terms of trying to be able to service the population that you love and care for. Talk about, keeping HIPAA in mind. Any particular case where you were actually in a scenario where you're like, man, this just doesn't feel right to me.
I do remember a particular client that was admitted to the hospital and then discharged to a long-term care facility just for rehab temporarily. This particular client had severe mental retardation. She had a 3-month-old ability, so she wasn't nonverbal. This person ended up getting a G-tube because at the long-term care facility they didn't know how to provide care for her. And it was very frustrating because here's this woman that we knew that would go out in the community. Yes, she was nonverbal, but enjoyed doing multiple activities and socializing, believe it or not. And the long-term care facility was deeming her unable to come back home to her home at Fidelity because they felt that she was nonverbal, and why feed her if in reality she can understand what was happening, that a G-tube made sense to prevent aspiration. And in reality that was one of her pleasures, to eat, as a matter of fact, pickles. She loved pickles. So it was very sad to see that at the long-term care facility, the doctors there felt that she didn't deserve quality of life, why. She didn't understand or comprehend what was going on. So it was frustrating when Fidelity was trying to get her to come back home. They wouldn't discharge her, and eventually we had to fight for it. And she's home, no G-tube.
No G2.
No G-tube
Wonderful.
since December of last year. It's amazing. This woman enjoys eating, enjoys life, enjoys her roommates, because they're her roommates, her family.
Yeah, that is her family.
So it was really frustrating to see how people would determine because of her mental disability she didn't deserve, to be taken care of at home, that she needed to be confined to a wheelchair. She couldn't get, she shouldn't have any activities because she had no comprehension of what was going on. So that's kind of frustrating to see how our population gets dismissed because of their mental disabilities. I mean, I can't tell you multiple times we go to hospital visits, clinic visits, and we wait the longest. Why complete lab work? I mean, this person doesn't know what's going on. Is it necessary to do yearly, for example, mammograms? I mean, they have a mental disability. Are you going to treat somebody with cancer if something happens? So it's really sad to see that a lot of doctors and healthcare providers don't acknowledge that they are human beings, don't define them by their diagnosis. They deserve a quality of life. They deserve to be like you and me in the community.
And it's so frustrating hearing this and knowing that we share part of that licensing responsibility, and that people don't look at the whole person. Mm-hmm. They look at the diagnoses to make these decisions that in their mind works, and it really doesn't work for anybody. You would no sooner treat you or I that way, or any patient that we love that way, and yet constantly it sounds like you're faced with that every day.
Yes, we have to advocate. One of our biggest responsibility in Fidelity is advocating for our individuals, because they don't have a voice. We are their voice. So, it's very important for us to install preventative measures for them, ensure that they are receiving the care that you and I receive, because they deserve it.
Absolutely deserve it. When you talk about in your line of nursing, some of the things that have to go into the care, because you just don't follow these folks for 2 months, because they have a cold. I mean, these disabilities continue on. Talk a little bit about continuity of care plans. Is it, like, for instance, you shared with me that you have 3 folks who I had the pleasure to meet earlier that are here. Who is responsible to kind of manage their care overall? Like, is it one nurse responsible with their workers and the aides, or do they have multiple care providers?
So they all have multiple care providers, yes, and we do have in the group homes, we have somebody we call a program director. So this is the person that manages the home. So this person that manages the home, again, has to ensure that the plan of care is being followed. This person also has an assistant. We have also CNAs that provide care. Again, we have outside resources too. We have physical therapies that come in, occupational therapists. We actually have NPs that come in at times to assess our individuals. So it's a multifaceted group that comes and actually builds a Fidelity home. So it's a lot of us, and social services they get as well.
So now, do you have like somebody who case manages, or is that part of your role as a nurse?
That's
it
part
sounds
of my
like you
role,
have so
yes.
many folks that you have to organize.
Yeah, so
fantastic.
So exactly. So we case manage them. The team, the human rights team, and the nurses, consulting as well as staff nurses, are responsible to come up with the care plans. We do involve the Human Rights Committee because of the disabilities that our individuals have. And a lot of the times, believe it or not, our individuals are involved in their own care plans,
I believe that, because they're the ones that are going to succeed at those care plans.
Exactly. So we have what we call annual meetings, and the clients that are variable or that have communication devices attend these meetings, and they contribute to their care plans.
So, it's phenomenal. I cannot imagine being able to keep your hand on everything that is going on and trying to coordinate all these different services. from a patient perspective, talk to me in terms of like the determinants of healthcare. How do you know that your folks are thriving? What are some of the things that you look at when you're managing those cases?
Okay, so decreased incidence of hospitalizations is one of the biggest ones. Again, the less frequent visits to the doctors, the less frequent medications they're having, decreased illness. By installing prevention, we decrease, negative outcomes, and that's what, assures us that we are going in the right direction.
Excellent. I know that you do a lot of different programs here, and you had mentioned that you have been working on some for diabetes. Talk a little bit about, one of the I know you've done so many, but one of the programs that you may have implemented or developed in terms of what you hope the impact will be, or what the impact has actually been.
So one of the current programs we're working in is a comprehensive diabetic education plan for our individuals. Unfortunately, the majority of our individuals have a diagnosis of diabetes, and we weren't seeing the A1Cs that we wanted. And even though we have staff that provide the meals, our individuals choose the meals they want. So they weren't making healthy choices. So we came up with a plan of how to educate them on what the right choices are, on their nutrition, on how important it is to go to these appointments, because some of our individuals don't necessarily want to go to their appointments. So we basically provided a comprehensive education plan that introduced the need of continuing healthy blood sugar levels, going to the appointments, picking the right meals, healthy choices for you. We gave them a pre-survey, and then we gave them a post-survey after the education plan, and there were positive outcomes actually. Interesting enough, they started doing healthy choices, and the way we followed that and analyzed it was by the blood sugar levels and the weight loss that we saw.
And with weight loss too.
Yeah,
That's outstanding.
Yeah, it was very cool.
Very good.
Yeah,
Congratulations on that.
It was interesting to see how the A1Cs went from 10 to 8, 7. So that was really good.
Yeah, that should make you feel good, but also your patients,
Yeah.
Because as you were mentioning before, I think a lot of folks will maybe put those patients on the back burner as to, well, they can't learn, or why, like you said, why bother because they have a mental disability, but that just goes to show that your advocacy and your programs are definitely making an impact, so that's fantastic. Now, I know, and sorry, I'm going to let this out of the bag, but I know you're currently in a program as well to get your NP.
Yes, I actually am getting my family nurse practitioner at Simmons College. I'm actually going into my second year.
It's fantastic. What do you want to do with that degree?
I want to specialize in psychiatric nursing, because I do see a lot of my folks that have psychiatric issues, developmental issues, and again, they don't get the services they deserve. I want to be out there in the community as an FNP, and hopefully when I specialize in psychiatric nursing, I'll be able to provide care for some of my folks,
I love hearing that. It definitely inspires me so much to see the work that you're doing here, and sort of the futures that you have in terms of not just your career, but in terms of the population you provide care for. So we'll play the magic bucket question. So this is my bucket list.
Okay.
What do you see as one of those big bucket list achievements that you want to do? Be it your NP, be it the group homes that you're involved in. I know you mentioned that you oversee 4 different homes. So what's on that bucket list for your career?
Again, to see that the individuals that have developmental disabilities are treated with respect, kindness, and they are getting the medical services they need. That's very important to me. I feel there should be more legal services for them. A lot of them don't have the ability to speak for themselves, and I think they deserve that right. And basically those are my 2 main focus, just to ensure that they're getting the services they deserve. Just because of their diagnosis of developmental disabilities does not mean that they don't deserve the services that everybody else gets.
Absolutely. I know you and I had talked a little bit earlier, not on this interview, but about funding issues, and whether or not it's the Affordability Care Act or other issues within the state of Massachusetts. Massachusetts has been a huge advocate for developmental disabilities. In fact, I happen to know that Barbara L'Italian has done a lot in terms of pushing this, not only because her son is a state representative, her son had autism and some other diagnoses, and she was able to get services not only for him, but for the elders. In terms of where these services are going, what are you hearing out in the community about funding, either on this election or with the changes to the Affordable Care Act?
So I'll be honest with you, I know it has affected Fidelity, but I don't know much to speak on it. I know that in the future they were thinking of opening more homes for people that have these type of diagnoses. But as of now, we're in a standstill. I don't know how we're going to go forward. I'm not sure.
But as an advocate, in terms of the necessity for these homes, do you think that their standstill is going to hurt the population?
Of course, without a doubt, without a doubt. You see a lot of people that are now having, not getting their appropriate meds and that's why they're having so many psychotic issues. I mean, they're not being cared for. We need more homes like this.
Absolutely. If you could change one thing in terms of how the community health needs aren't being met with respect to the what I'll say traditional hospitalization, nurses and doctors in terms of the institution, what would you?
I would set special guidelines for them.
Okay.
They're not, your regular, patient. They're nonverbal. I think they deserve to have a more guided care for them. For example, if I'm nonverbal, I can't reply what I'm feeling right now. They should have ways to communicate with our individuals, not just assume that because they're nonverbal and they have some delays, they don't deserve the care that you and I deserve. So they should come up with a good program to be able to communicate. Healthcare providers need to be able to distinguish our population and care for them in that way because they do have special needs.
Absolutely. Standardizing level of care throughout the community would seem like it would be helpful. But these are great aspirations. Okay, I'm going to have you talk a little bit. You had shared that you did have a member pass in the House. How does that affect you as a nurse? We all have our scenarios where we get, caregiver sorrows and sort of we hit those peaks where we actually need support from other nurses, other professionals when we go through losses such as that. Talk to me about what you have for support for that.
So when our particular individual was diagnosed with colorectal cancer, it had metastasized. And we had no idea, again, this individual was nonverbal. And at the time, the doctor felt there was no need to complete a colonoscopy. And the issue was we didn't understand why was the weight loss. Why was this individual not wanting to eat? Why was this individual crying constantly? And it took a lot from Fidelity, a lot of the nurses advocating and our VP actually meeting with these doctors to say, listen, we need a colonoscopy. We need to see what's going on. And again, it was a little bit too late when he was diagnosed. A week later, he passed away. It was very difficult. I've worked for Fidelity for, 2 years now, and I absolutely loved this individual, and it broke my heart. He was 41 years old, a quadriplegic. And it was difficult, but we did get resources from hospice. So hospice nursing got involved, and our human rights committee got involved and really supported the team. Because it's hard to see, somebody that you've provided care for so long change and decline. This individual was 160 pounds and ended up weighing 78 pounds. So it was heartbreaking, and we're talking about in 3 months. Once he was diagnosed, a week later he passed away. It was very hard. But we did get our support from our team, and the hospice nurse were amazing, and also his primary. Again, a lot of the specialists didn't want to do the procedures that the primary had suggested because of the diagnosis, and they felt there was no need because of his age. He was 41 years
It
old.
was clearly a need.
Yeah.
So sorry you had to go through that.
Oh yeah, no, it's okay.
Definitely tragic. So next steps for you. You're in school.
Yeah.
You're here. You're
Mhm.
taking care of a full boat. I know you have your children, and you've got a huge plate. What's your next step?
Well, next year I start actually my preceptor following the doctors, and I'll do that for a year. Then I'm planning to work in Greater Lawrence, which is the clinic that supports Fidelity, and from there on I want to proceed and get my psychiatric NP and
Awesome.
continue to work in the community because this is my passion.
Good. Well, it shows. I want to thank you so much for your time
No problem.
and energy. Is there anything that you want to share with me in terms of I was somebody going out and wanting to get into your varied line of work? I mean, you do it all. You guys really do it all. You see all the facets. You see the frustrations from the hospitals. You see the frustrations in terms of managing care. You have an ethics committee here. You have resources to help with hospices, PT, OT. I mean, you see so many different facets of truly providing care for what I would consider a truly vulnerable population within our communities. What would be your suggestions for me if I were to want to go into public health and try to emulate what you've done?
Again, community health nursing is a must-have asset for our community. It's a great position for someone that has compassion and desires to help those that are less fortunate. In my case, people with developmental disabilities. This area of nursing requires a great deal of patience, but ultimately it's highly rewarding. I was seeking to make a significant contribution to my community, and this position has given me that ability. I think that the more you're exposed, the more experience you gain on how to treat this community.
Fantastic. I want to thank you for your time.
Yes,
And
thank
thank you for the tour.
Yes.
It truly is a very special place.
You're amazing. You're going to do fabulous.
So thank you so much for the vote of confidence. We're ending. And we're off.